Hello everyone, my presentation today is on visual impairment and my name is Amani Fields, so let's get started. What is visual impairment? Visual impairment can also be known as vision loss, not to be confused with blindness. It is the loss of vision that cannot be corrected by glasses and or contacts. Those that do not have access to glasses or contacts contributes to the decreased ability to see. Visual diagnosis does not affect everyone the same way because everybody's eyes are different, everyone's lenses are different, some people have different size lenses, and so forth. So loss of vision cannot be restored, unfortunately, but it can be managed, which is very hopeful. The sooner vision loss is found, then treated, the greater the chances of keeping whatever vision the individual has left. Okay. Symptoms of vision loss and impairment. Some symptoms include severe, sudden eye pain, recurring pain in or around the eye, hazy, blurred, or double vision, flashes of light or spotting, and any sudden change in vision. Okay. Diagnosis of visual impairment. Diagnosis begins with complete family history and history of visual impairment. An external examination of the eye is conducted, including the lids, conjunctiva, iris, lens, etc. Other tests for diagnosis for visual impairment would include the Snellen test, which is the visual eye chart. That's the chart that you see when you go to the doctors, when you go in for a physical, or if you wear glasses and you go see the optometrist. That eye chart is what you would use. They'll say cover your left eye and read the letters and so forth. So that Snellen test is used for diagnosis along with other visual field tests. So here are some contributing factors that can lead to vision impairment. So cataracts are the #1 cause of blindness. This can be easily treated by surgery, and I've also I linked a YouTube video that shows this surgery. I decided to go with a 3D version just in case those who are squeamish wouldn't really want to see a real life version. So I'm going to play it for a little bit so that you can see what exactly a cataract removal surgery looks like.
Surgery begins with a self-sealing incision. In this case, a limbocorneal incision. Using a crescent knife of 3.2 millimeters width, a perpendicular pre-cut is made at the limbus, followed by preparation of a corneal tunnel, and then entering the anterior chamber.
So this video is about 7 minutes long, but it's there for further information in regards to cataract removal. So some more contributing factors would be glaucoma, which is the cause of fluid to build up in the eye. And then glaucoma also causes pressure in the eye, which then increases, and then it can destroy peripheral vision. So those that have glaucoma pretty much have tunnel vision. They can't really see to the far left or to the far right. They have issues with that. It's not so much that their vision is completely lost. Those that suffer from glaucoma, they can barely see. They don't really have peripheral vision because glaucoma can destroy that. So also there is diabetic retinopathy. That causes abnormal blood vessels to grow over the retina. It causes blurring blurring of vision, and laser therapy is used to burn off at normal blood vessels. So what is the relationship between visual impairment and blindness? So blindness means that a person cannot see, and that would be inclusive to light as well. So if you're completely blind, you can't see anything, you can't see rays of light, you can't see anything. It's like complete darkness. There is partial blindness, where most vision is lost but cannot be corrected by glasses or contact lenses, unfortunately. Vision loss refers to the partial or complete loss of vision. Vision loss can happen over a period of time, not all at once. Some types of vision loss never lead to complete blindness, but the thing about vision loss and vision impairment is that it's not sudden. It gradually happens over time. That's why it's important to go visit your doctor if you are experiencing any of the symptoms or discomfort. Then it's better to catch it early before it's too late. Okay, so is visual impairment genetic? There are certain types of eye diseases that are genetic. I've listed a couple so far. So congenital cataracts, that is present at birth. So if a baby is born and they have cataracts, it's better to know it then, and then removal would happen after. Strabismus, which is ocular misalignment, so your eyeballs are like not aligned properly, and that can cause visual impairment. So patients with systemic genetic diseases have the availability to work with genetic expert specialists to integrate treatment to the patient's care plan. So that is helpful that you can work with a geneticist in regards to what to do to help with visual impairment. Medication. So, like I said earlier before in my previous slides, loss of vision cannot be restored. Medications are provided for controlling diabetes, because diabetes can lead to vision loss if you do not take care of yourself properly or manage your diabetes the way that you should. And then you'll have medication post-cataract surgery to make sure that your eyes aren't clouding up anymore. And then glaucoma includes medications in regards to like being prescribed certain eye drops to kind of help with the vision, because like I said in my previous slides, those that have glaucoma do not have peripheral vision. So does visual impairment affect the exercise response? So certain eye conditions can be affected by bending, lifting, straining, or rapid eye movement. So it's recommended that exercise plans are discussed with the doctor, and it's also good for fitness instructors to consult with the doctor just to make sure, like, hey, is this program fit for my client? There are no specific guidelines for individuals with visual impairment, though it is crucial to take into consideration for other health issues. So you might have a client that is visually impaired but might have diabetes. So you have to take in consideration other health risks. Also, safety is the main concern where there is loss of vision, because you want to decrease the risk of injury, especially if you're prescribing resistance training in your workouts. So you want to make sure they're stable, they can handle the weights pretty well, that sort of thing. So here's some of my exercise prescriptions that I came up with. So I came up with the general warm-up, which consists of 3 sets of 10 squats, 3 sets of 10 jumping jacks, 3 sets of seal jumps, and 3 sets of 10 crisscross jumps. I specifically chose this warm-up because it tests balance and coordination simultaneously. Because when your vision is impaired, your sense of gravity and your sense of balance might be a little bit altered. So I wanted to incorporate exercises in my warm-up that help test balance and coordination, as those are really, really important. So for cardiovascular fitness, I chose something pretty simple like running on a treadmill. That's pretty stationary, and that is a more of a controlled environment, because you definitely want to control the environment around you in regards to a patient that is visually impaired. So I said to run a mile on the treadmill at a 1% incline to decrease chances of shin splints, because you don't want to run like on a super flat surface. You kind of want to add like a bit of a hill to that. And then I said they should run at about 6.5 miles per hour, depending on the fitness level. I mean, obviously you can go up higher or you can go up lower, depending on what their fitness base is. So that's always subject to change, but I just chose 6.5 as like a baseline, which is about an 8 to 9 minute mile, give or take. And then I also included 30 minutes on the elliptical, again, controlled environment. I incorporated flexibility exercises, so 4 sets of 20 hip abductors, arm across the chest, that's this exercise like that, glute stretch, and standing calf. So all of those are basically exercises that you can kind of control and won't be too hard or cumbersome for someone that is visually impaired. And then a program cool down would be like a 5-minute jog at a comfortable pace, because you don't want to overload them. And then in conclusion, visual impairment comes in many forms, whether it may be loss of vision or complete blindness. This does not exclude this population from engaging in most activities, depending on, well, it's dependent upon the severity, of course, as those that can see normally. So basically, those that are visually impaired, there's nothing that can really like stop them from engaging in most everyday activities. I hope that you have a better understanding of what visual impairment is and how there are other contributing factors or disease that can lead to vision loss. And then these are my references along with more references. So bye, thank you.